spread. We are not singling out who will get what. The only case where you have an exception as it relates to that is we have been very clear that where there is a lockdown, as authorized by the president in Abuja, Lagos, and Ogun, you are definitely going to have a disproportionate extent of adverse impact as a result of the lockdown on those locations. So clearly, I mean, common sense would say that you have to make sure that you do some things in those locations that are unique to those locations because of the unique circumstances that they're under. So the president has authorized for the release of relief packages to satellite towns and communities where the most vulnerable segments of the population reside around the lockdown zones. But in terms of the national palliatives, they are truly national, and Cross River certainly will indeed benefit. The last point I want to make very quickly is not only are we looking at the lockdown zones, but the president was very clear in his address that we are obviously thinking ahead about ensuring that we stop the spread into places like Cross River State that don't yet have a confirmed case, which is why you've seen the establishment of new molecular evaluation laboratories to enhance our capacity to test in states where we have not yet recorded a case, places like Maiduguri, for example.
I understand the need for you to be elaborate on some of these issues.
Yes, it's important for our people to understand the details. We can't.
We've got well over
Right.
40 questions,
Right.
like I said, and would like for you to attempt as many as
we
possible.
can.
So we'll take the next question now from Lagos.
Right.
Good morning. My name is Ada and I'm in Lagos. I have this question for the government. Okay, so in recent times, there has been several donations to the nation, nationally by corporate bodies, individuals, and internationally as well. Now, my question is actually, how exactly is the government utilizing these funds? Now, we haven't seen in the news or heard on social media or anywhere that government is erecting a standard isolation center in any location in the country, except the one being done in Lagos. Now, we also haven't, seen the government use part of these funds as welfare packages for the people who have to stay at home, especially for those people who earn daily. So I really want to know, how exactly is the government using these funds that have been given to the country in this critical period? Thank you.
Thank you so much, Ada, for your concerns and your question. Let me start from how funds are being managed from the private sector. There's the Coalition for the Response to COVID-19 of private sector actors known as CACOVID. That is being coordinated by 4 different committees. You have the steering committee chaired by the Secretary to the Government of the Federation, Mr. Bas Mustafa, who essentially links, the committee with all of the concerned state governments in terms of where certain infrastructure will be located, where certain equipments and materials will be sent to. Then you have the technical committee, which has the World Health Organization, some of the other, the Bill and Melinda Gates Foundation and other technical partners that give us the data that essentially informs our decision to put what infrastructure where. Then you have the finance committee, the funding committee. That is the members each of whom have contributed over 1 billion naira each. And then you have the operational committee, which is the committee that actually engages in project management, engages in the implementation of the project, oversight, logistics, advocacy, etc. That has to do with the Dangote Foundation, GT Bank, Eco Bank, Fidelity Bank, and other corporate bodies at the organizational level. Now, it's important to note that all of this, I've said all of this so that we have a clear understanding that this is not a government fund, quote unquote. This is not a situation where some private sector actors are throwing a whole bunch of money in a pot and they're saying, government, go spend the money. This is managed by the private sector, funds that have come from the private sector for the sake of Nigerians. As it relates to some of the ideas that, my sister had mentioned in her question or contribution, the idea that there hasn't been erection of new facilities outside of Lagos, I think that's clearly something that we need to educate our people on, because that's false. In Abuja, we have a new 200-bed facility coming up. In Port Harcourt, we've already seen the news where Governor Wike, for example, has been oversighting the construction of a 200-bed facility, not funded by the River State government, however, funded from the center. And then, of course, you have the same in Enugu, 200 beds, and then you have a 500-bed facility in Kano. additional 1,000 bed capacity coming up in Lagos, including the 110 bed that was just unveiled at Onikan Stadium. So there's a lot going on, and that does not even include the development of new molecular evaluation laboratories that we've seen come up in Port Harcourt, Kaduna, Kano, Abakaliki, Ebonyi State, and many other areas in the country. So there's a lot of work going on, and it's managed by the private sector, the funds that are coming from the private sector.
I hope that answers your question, Adele. If you're watching, well, we'll move on very quickly to the third question now.
Hi, my name is Aisha Musa Saleh from FCT Abuja here. And my questions are, is it really a good idea to open the market every day? And do we have persons on ground making sure that the rules on social distancing are being kept? Regarding the issue of opening market every day, we have people moving around the city, and we're not even sure if they're going to the market or the hospitals. Who is on ground making sure that these people are not going to visit relatives or even attend small gatherings around? And my second question is, do we have regulatory bodies on ground penalizing the shops, stores, supermarkets, and even markets, even the local market people on price hiking? Prices are bizarrely high, and people with money are complaining. Then what happens to people that don't have the money? People that don't have the money or wait for others to give them the money cannot even purchase these food items because they are unusually high right now. So we want to know what the government is doing or will do regarding this issue. Thank you.
Thank you very much, my sister. I think her questions are very, very apt and intelligent. And let me just start from the point of the restriction that's been put in place in terms of market access between 10 a.m. and 2 p.m. To answer her question, yes, it is restricted, which means that you can't put a restriction in place without forces that would regulate and ensure the enforcement of those restrictions. We certainly have personnel doing that, not just security, by the way, but also public health personnel, so that people are passing through the protocols that they need to pass through in order to access these facilities. But I also want to emphasize that there's no way that we are going to effectively tackle COVID-19 in this country if the assumption is that all of us are just looking to government to solve the problem in a silo. We all have a role to play. What that means in the context of what she has asked is, if you're one of those who are going to the market to pick up a loaf of bread or a bag of rice or whatever it is, and you see some sort of gap in terms of regulation, or some sort of small gathering that should not be taking place, or even if it's down the street, your neighbor is having a birthday party with 25 people and that's over the stipulated amount of people at this time, then you absolutely do have a responsibility to make sure you call the hotlines that have been given out to the Nigerian public to make sure that we hold those people accountable. So it is a team effort between our people and the government and our people, and that's how we're looking at it. Now, to her other questions about price hiking, we have been very active on this. The Federal Consumer Protection and Competition Council, FCCPC, headed by Mr. Babatunde Irukera, has been very, very active, not just in actuality in the physical, but even on social media online, has been very active in terms of saying, look, if you have any complaint anywhere, you tell us the store, you tell us the location, we will go there. And he's been out and active in making sure that, I think there's even a lawsuit has been filed against some individuals who were in a very unscrupulous manner hiking the price of hand sanitizers. So government is taking action, and we're going to continue to, but we certainly need the cooperation of our people. Just
before we go on to the next question, I'd like to ask you this. Are you satisfied with the impact that the restriction is making, or are you achieving as much as you hoped to achieve with the restrictions in place?
Absolutely, and I think this is an area where I just want to compliment and appreciate our people, because they have really been on the large scale very cooperative with us in terms of not coming out unnecessarily. We don't have situations of many people coming out without a real need to come out. So we're encouraged by what Nigerians are doing, and we're just asking for more of it. With that said, for us, the restrictions have enabled us to do the following. When you're contact tracing thousands of contacts, predominantly the 3 zones where you have the most of the bulk of the approximately 3,000 or 4,000 people that we're now looking at. The restrictions have allowed us to, in a very uninhibited fashion, without having to worry about road traffic, without having to worry about going through so many multitudes of people, we can actually access those people where they are, particularly because most of these are aviation based. And when these people were coming in from overseas, many of them were intentionally putting wrong addresses, wrong numbers, which means that you now have to trace them on the basis of the information given to the airlines. That is a long thread of investigation that has to go on before you can identify where they're coming from, where they live, where maybe their brother or sister lives, so that the brother or sister can tell you where they live. And that's the kind of contact tracing that we're involved with. So the restriction has certainly enabled us to do that most effectively.
All right, then we'll go to the very next question.
James Komolafe, team lead at Saba Resources. As a behavioral therapist, the effort of government is quite commendable, especially the presidential speech on COVID-19 last Sunday. 2 strategies were reeled out: profound, preservation and protection. I believe the third strategy lies with the people, which is the production. Now, what effort has the government made or is making to ensure that people don't run riot into the negative side and consequences of lockdown? We need to educate them to be able to cope well and be productive. And then secondly, what are the post-COVID-19 policy frameworks government is developing on a behavioral note in order to institute a policy framework for national development? Because prevention is better than cure. Thank you.
I very much agree with my brother. Prevention is better than cure, which is what necessitated the action of the president in the first place in terms of the lockdown. There are a series of things he mentioned. The behavioral attitudes and trends of our people during this time. I've already discussed that a little bit in saying that we've been very pleased with the reaction of our people. They have very much, in large part, complied with government directives, and that has helped us immensely in terms of protecting all of us from the further spread of the virus. The other issues he raised had to do with the post-COVID-19 era, what frameworks are in place. Very, very, very important question. And, first of all, the president just directed, I believe it was last Monday, the constitution of a brand new Presidential Economic Sustainability Committee being chaired by Vice President Professor Yemi Osinbajo. That committee is very, very crucial for multiple reasons, and we want to make sure that our people are sensitized about this. Not only is that committee dealing with how to evolve new palliatives that are direct to the citizens of the country in a way that is free of corruption, in a way that is free of resource misappropriation, in a way that's more automated. We want to try and leverage on the technologies provided by, obviously, the Nigerian Interbank Settlement System, NIBSS, the BVN, to ensure that whatever interventions we're making are in a form that will get to our people as desired and not in any way diverted. So we're working very hard on that on a large scale, and also in terms of the post-COVID aspect, the committee is now saddled with the responsibility of developing a long-term economic plan for the country for the post-COVID-19 era, which is going to obviously involve targeting those sectors with large-scale cash interventions, liquidity interventions, to ensure that we are able to expedite the process of moving from self-sufficiency in food production, for example, into export dependence, so that we can diversify the economy away from the volatilities and whims of the global oil and gas market.
Okay, great. We also have a couple of questions, coming from outside of the shores of Nigeria. We do have a question from someone from a Nigerian based in the UK. I think we'll take that now.
Good afternoon, Mr. Honorable Advisor to His Excellency. My name is Mr. Ugachukwu Uchebu. I live in London, United Kingdom. My first question is this. There is a rise in panic level, which is fueled in many cases by misinformation. So how much of a threat do you think misinformation and panic is affecting the country's fight against this pandemic? And my second question is this, sir. We understand the enormous demands that it requires in resources to fight this pandemic. I would like to know, sir, what does Nigeria as a country have at its disposal to battle this invisible enemy?
Thank you very much. Let me start from the first point, about misinformation. Misinformation has been a huge threat across the social media landscape. You're seeing fake news reports about the Minister of Humanitarian Affairs, allegations that she's handing out money to only a certain ethnic group and not other ethnic groups. Other divisive content about an outbreak of COVID-19 in Kano that did not exist, and all of that. That makes everything more difficult, because when a small group of our people decide that they are going to sow distrust into the environment, what it does is it undermines the credibility of the government in the eyes of those who are needed to cooperate with us in order to maintain our comprehensive overall security as a country. Threat of misinformation, not the government, but all of us, because it undermines our ability to work effectively with our people. With that said, we counter misinformation with information. We counter falsehood with truth. We make sure that on a daily basis, almost on at least 2-3 times a day, you're hearing directly from the NCDC with the updated case levels, how many cases, where are they located, how many deaths, if there are any, how many rehabilitations or discharged patients, if there are any. So we are up to date in real time, and the reason why we do that, even when the news isn't good, even when we have 20 new cases in a day instead of 1 new case, we make sure that information is out there, because it's not about whether it favors government or not. It's about whether or not we're being honest with our people, so that we have the credibility to be effectively cooperated with by our people.
All right, great. So we'll take another very quick question, this time again from outside of the shores of Nigeria.
My name is Paul Arnold Inamiti. I am in Cyprus. Is the Nigerian government seriously considering evacuating its citizens from abroad? And is there any development on Nigeria producing its own cure? So it's a cure in development in Nigeria. Thank you.
Fantastic questions. On the first part about whether we're evacuating our citizens abroad, yes, we are. The CEO of the Diaspora Commission, Mrs. Abike Dabiri, has already come out to tell Nigerians that we are working out the modalities of doing exactly that. And not only are we doing so, but we're also on the other question in terms of whether we are making moves toward a vaccine. What we're doing in large part is we're focusing on tackling this crisis, not with the present view in mind only, but with the future in mind. What I mean by that in practical terms is we have put in place a 100 billion naira intervention for the healthcare service delivery system in the country, to ensure that we create the infrastructural backbone that would now support our very talented medical practitioners that go to the US and UK and thrive, but don't thrive as much here. We're trying to solve that, bridge that gap. How we're going to do that is we're going to establish research and development and innovation laboratories across public health institutions around the country. We are offering major facilities, large-scale facilities to Nigerian drug manufacturers to expand existing drug manufacturing plants in the country that will employ our people, that will reduce importation. And we're also extending major facilities out of the 100 billion to private hospitals that have a proven standard that they can use to expand their ICU units and some of the things that are very, very important looking ahead. So all of that is in play. But in terms of the vaccine, it's very clear that globally there's about a set of about 3 to 7 companies that are working on a global vaccine, where you have billions of dollars being poured in from all sorts of governments around the world and philanthropic organizations like the Bill and Melinda Gates Foundation. They have made it clear that there will be no vaccine for COVID-19 until a band of about 12 to 18 months have elapsed. So we're still a ways off. We still have encouraged our indigenous scientists to embark on that journey, on that process, to see what can happen, and we are supporting them wherever they've asked us to. Certainly that's the case, but we're also aware of the global dimension and what is being invested in terms of a global vaccine.
Great. So we'll take another question very quickly, but this time I think we'll come back home and we'll take a question from Lagos.
My name is Tayo George. I'm based in Lagos. I'd like to commend the federal government for the palliatives provided to the vulnerable and the poor during this period. However, there are concerns that some of those items are not sufficient. People have been saying that maybe there's a problem somewhere. It's so that you give a bag of rice to, like, so many people. It's not even sufficient. So of what use is this? I think measures should be taken to check how far these things go. It's very important, so that at the end of the day, it will amount to what are the efforts put in place to check this?
Thank you very much. We've kind of touched on that a little bit, but I'm going to go into a bit more depth so that our people are not misled by anyone as it relates to what is happening in terms of the palliatives. First of all, let's appreciate where we are economically. Right now, we have seen our crude oil revenues, which is obviously 90% of our export earnings as of today, cut in less than and more than half, right? We are in a situation right now where, in terms of the federal allocation to states, for example, in FARC, has gone from about 600 billion naira on a monthly scale down. We're looking at by June to probably get down to about 400 billion across tiers, across states. That is not good. So what that means is, when we talk about palliatives, we have to be very, very aware of the fact that our economy is not today what it was 6 months ago when the oil price was normal. This is the way it is for economies that are still working to diversify as we are. So this is the reality. Now, with that said, the palliatives are as follows. I've mentioned the 1 trillion naira fund from the CBN, 1.1 trillion, which is manufacturing, agricultural facilities. That includes the healthcare service delivery injection, as well as the 50 billion for micro, small, and medium scale enterprises and households across the country. But in terms of the direct palliatives, I've mentioned that the Economic Sustainability Committee is breaking, as we speak right now, are working out the details of the direct interventions that are going to be made. As soon as that information is available, it will be given to the public. And I also want to just quickly mention that we have a 500 billion naira special intervention fund, which is going to fund a series of public works programs that are going to employ.
That's the stimulus bill before.
That's right, 500 billion. That's not only going to include direct cash injection, but it's also going to include financial incentives for MSMEs across the country who refuse to sack their workers during this temporary time of hardship. We're looking at how we can maybe give them some tax credits and some other things to ensure that they don't lay off Nigerian workers.
We're going to attempt to take a couple of questions in quick succession because we're fast running out of time. So we'll take 2 questions back to back, and we'll make you respond to these 2 questions immediately.
Hello, good day. I'm Dr. Chris Ifediora. I'm an associate professor of medicine that lives on the Gold Coast in Australia. I'm from Anambra State of Nigeria. I'm very pleased that this program is going on because Nigerians need to be enlightened. I have a couple of questions for you. The first one concerns the quarantine system in Nigeria. It is a very commendable program, and I'm very pleased that the federal government acted to close off the borders. But my question borders on people coming back to Nigeria, like myself if I should come into Nigeria. I understand there's a quarantine system where people are supposed to self-isolate for 2 weeks. That is very good. But in reality, how possible, how much is the federal government doing to implement this?
Okay, so that's the first one.
Right.
So I'll play this.
My name is Chuma. I run a design firm in Lagos and a social enterprise design hub. Part of what we do is social innovation. So I'm very curious and I'm very intrigued that you're here, sir. My question to you is, beyond all the money that has been donated and all of the response that people have made, I'm a bit worried about how post-COVID-19, how are we going to ensure that we have a sustainable plan in place that will help us fight some diseases, as opposed to this knee-jerk reaction of, okay, there's money, something happens and then we react. What are your plans in place? Does this provide an opportunity for us to now actually develop a sustainable healthcare system?
Thank you very much. So let me just start from the first question, which was...
And sorry, Adri, I'll butt in here. If it's possible for you to take that in like a minute, more questions.
I'll try,
and so we can also see if we can take 2 more questions just before we
that
wrap
great.
up. Yes.
Thank you very much. As it relates to the question about returnees, we've been very clear that our people are our people. We have to take care of our people. If they're coming in, we've had instances, obviously, of the land border. Some returnees from the Ivory Coast came in, some of whom had COVID-19. right, we were able to very quickly act and make sure that before they got into the country, we were able to screen them, put them through the testing protocols, which is how we found out about it. We were able to isolate them, quarantine them, and then those that were not affected are under surveillance as well. So we have the mechanisms in place to ensure that we return our people in a way that is safe for the people who are already here.
And then the question from Chuma in Lagos?
Yes, the question from Chuma about the sustainable healthcare system, I addressed that with the 100 billion naira injection that is for that purpose. But in addition to that, some of the other mechanisms we put in place, the 13, we started out this crisis with 5 molecular laboratories nationwide. We are moving up to 13 molecular evaluation laboratories across all geopolitical zones within the next 10 days. These laboratories are not going anywhere. They're not going to be brought down or anything like that. In terms of some of the permanent structures that we're putting up around the country, they will not be brought down either. So look, we are committed to it. We are laying out the plans very clearly, and we are going to abide by those plans.
We're absolutely out of time, but we'll just take one question, and you use that to round off.
Hello, my name is Imewari Ohiomohai. I am a media personality based in Abuja. My question for Mr. Ajuri Ngelale has to do with the COVID-19 palliatives. Who were those who benefited from this COVID-19 palliatives? I know there's a social register and all that, but can we know how many people, especially from the southern part of the country, that benefited from the COVID-19 palliatives? We would like to have the example that's been flying around that it's